All right, well, I don't want to delay too much. If the team's all set, we can advance. Is everyone in agreement that we can start?
Good.
Okay.
All right, very good. Well, welcome everybody to Northeast Airport Recovery Summit, sponsored by Fusion Cell. I'm Melinda Montgomery. I'm the Vice President of the Northeast chapter, and I'm pleased to be your moderator today. The Northeast chapter is pleased to present educational and informative platforms such as this to keep us up to speed with techniques and technologies. It keeps us relevant and keeps us connected to our members. We are you, we're airport people, we're airport consultants, and we're here for you as well. And we're here to provide you with this informative platform. So today, we are going to have some really fantastic presentations from Fusion Cell, and I'm going to just read off specifically the intro for them because I want to be very specific and not leave anything out. But from Fusion Cell, we've got Matt Morrissey, he's a COO, and we've got Mike Klingshirn, he's the Director of Consulting. Fusion Cell, really interesting company. They're a premier staffing and consulting firm with a mission to help companies tap into the elite and experienced talent pool from the U.S. military. Always very important, near and dear to our hearts. Fusion Cell provides full and part-time staffing services that help companies identify, recruit, and retain highly qualified military talent for specific business needs. In addition to their staffing services, Fusion Cell offers emergency management consulting services, including COVID health and safety consulting. Fusion Cell's team, as you will see today, includes board certified public health epidemiologists and logistics experts that have decades of training and experience helping U.S. military bases maximize output in the face of pandemics and disasters. They are now applying that knowledge to businesses and schools to help them reduce the spread of COVID-19. In addition to Fusion Cell today, we have US Echo Products. We have Doreen Blades, the founder and president. US Echo Products Corporation is a company focusing on green and sustainable products and services. US Echo Products Corporations bring sustainable solutions to airports, FAA, Navy, Army, Air Force bases, and commercial companies. US Echo Products Corporations brings together multiple solutions for the best fit for their customers. Okay, and last but not least, we have Honeywell. Honeywell brings us today Deborah Becker. She's the airport's market leader. And Honeywell is a Fortune 100 technology company that delivers industry-specific solutions that include aerospace products and services, control technologies for buildings and industry, and performance materials globally. Honeywell Technologies helps aircraft, buildings, manufacturing plants, supply chains, and workers become more connected to make our world smarter, safer, and more sustainable. So those are going to be our presenters today. I am looking forward to it. Our overall topic today is airport strategies for operating in a COVID climate and beyond. If you're like me, I'm an airport manager of a small commercial airport in New Jersey, Trenton Mercer Airport. And I'm no stranger to responding to this pandemic, but I'm as confused as the next person, and it's going to be very informative today to get more facts and provide us with some techniques and technologies that are functional and useful in our environments. And so I look forward to bringing you our presenters. Housekeeping, a little bit of light housekeeping. Please keep yourself on mute unless you wish to speak. Use the chat feature. If you're not sure, you tap on the bar below. You'll see chat. Hit the chat and you can type in your question. I will be the moderator. I'll be looking at the chat feature and the questions. if, not that your question's not important, but if it's relevant to sort of interject, I'll interject. But I believe the speakers would prefer, if we can, to leave the questions for the end. Okay? So with that, did I forget anything that the speakers wanted me to mention? No, Mike and Matt?
I think you nailed it, Melinda.
All right, very good. Well, with that being said, I will give you Matt and Mike from Fusion Cell.
All right, great. Thanks, Melinda. Perfect introduction. We appreciate it. And welcome, everyone. I know that the year's winding down, and you're probably your last couple days, if not last day, before you head to some holiday breaks. So we appreciate you making the time today. I do think that we have a pretty dynamic agenda for you. And I'm going to walk through that a little bit. We just did the introductions, but Mike and Doreen and Deborah are going to speak a little bit about their specific backgrounds to give you some context to what they bring to the table. We're then going to walk into what Fusion Cell we refer to as the Big Six for COVID intervention. We have the benefit of having a military board certified public health epidemiologist on the line today, and Mike. And what he'll allow, I think, is to cut through a lot of the misperceptions about the disease and talk about the strategies that actually work and the U.S. have been using in the military for decades in fighting virus outbreaks and pandemic outbreaks. And then specifically how some of U.S. eco products and some of how Honeywell's products fit into this paradigm for a plan that you can put together for your airport. And it's going to be very targeted to those different areas. In some ways, I like to say that we're going to bring it down to almost a third grade level in some cases, because I know that's what I can understand. But it really makes what can be a daunting and complex topic a lot more easy to digest and see how it specifically works within the airports. We're also going to talk through and walk through in specific the case study of Manchester Boston Regional Airport. I know most of you probably know of Carl pretty well. And we spent the summer with Boston Regional Airport in putting together their COVID strategy. And we're going to talk through what it ended up looking like for them. Carl was to be on the call, but he's a little bit under the weather, which must mean a lot under the weather for Carl to miss something, because he's a badass. So at the end of the call, we will also open up to Q&A. Again, we have Deborah and Doreen have been in this industry for decades. Mike has been doing this for a long time. And we're going to give you the opportunity to ask questions that we can answer as well. So I'm going to kind of move it over to Mike, and he's going to start talking through a little bit, like I said, from an elementary standpoint, background, and then the other two speakers.
Thanks, Matt. So Mike Klinkshern, originally from the west side of Cleveland, so for the Northeast Ohio Airport out there. Hey, I'm currently in South Carolina, so I have a little bit better weather. But throughout the years, I grew up with the Air Force. So I graduated at University of Toledo from their pharmacology program, and then moved right over to the Air Force recruiter that was about a mile down the road, who promised me a master's degree and a couple years of employment with the Air Force. I stayed 10. I've earned my master's in public health and epidemiology, a graduate certificate in biostatistics. I've maintained my board certification. Currently, it's been the past 10 years or so. And so, like I said, I grew up in the Air Force. 10 years, I just transitioned out to the civilian sector in August. But in that time, I've had the chance to lead the equivalent of health departments at different bases throughout the United States and then abroad. I've helped stand up Task Force COVID. So this was that big military push to help move assets that the military has into civilian organizations when they become overrun with COVID cases. So if you think about New York City, or when we moved up to, just outside of Philadelphia, Temple, I think it was Temple. And we set up triage stations around the cities. And then additionally, doing the same thing, but for all of the Middle East, all the Air Force bases out there. So it's been challenging, but these are the elements, and this is the experience that we bring to the table when we talk about building these COVID plans. So we've been with 12 different schools, a couple of businesses, an airport, country clubs. We've run the gamut, and we helped develop those unique plans that support safe operations.
Sorry about that. I had myself on mute. Hi, good morning. I'm Doreen Blades with US Eco Products and the founder and president of US Eco Products. My background is not as impressive as Mike's. However, I did start out at UMass Amherst with pre-med and ended up with psychology. I've had additional education. I'm part of the WeBank, which is Women Business Enterprise National Council. I attended their energy executive program in Louisiana on Shell's training site for where they're training their staff to go out to the rigs in the ocean, and also attended their Tuck Dartmouth executive program. And I have many years of experience in copyright and others that don't apply here. US Eco Products, what we do, we focus mostly on green, sustainable products and services. So we have the products to clean up the spills. We also are currently working with FEMA. We're working with the U.S. Army Corps of Engineers. We're working with the Otis Air Force Base in Warren, Massachusetts, and the FAA. We're doing the cleanups, the feet on the ground, hands touching, doing the cleanups. And we also have additional customers such as the Virginia Department of Transportation, Keolis, Encore Casino, the Navy. And we will be providing porta potties for the inauguration in January 20th. I'm allowed to say that now, today. So we're pretty extensive. We work around the US. So, and on to Deborah.
Thanks, Doreen. And Melinda, thanks for the introduction, Mike, Matt. Real quickly, Deborah Becker, no medical experience. All of my industry experiences in the design and construction industry. Started as an architect. Now I work for Honeywell several years later, and very passionate about building and sustaining smart buildings that are healthy, safe, and driving green construction. So I've been with Honeywell almost 11 years, focused on the aviation industry and participating with our customers on really trying to provide one standard of care, which is an issue in the industry right now, right? To know what you get from airport to airport for passengers and trying to rebuild their confidence. So we've pivoted some of our technologies from other verticals like in healthcare, and we'll talk about that a bit today, and bringing it forward into airports to provide a safe and healthy environment. So Honeywell, we touch pretty much everything from aircrafts to the air side to the airports, and we're in, I think, over 500 airports globally. So thanks for the opportunity to be here.
Awesome. All right, so like Matt said, you're going to get the epidemiologist perspective, the science behind COVID, but I definitely do want to say that this is not endorsed by the military or the Department of Defense. Just kicking that out there, that these are the same principles that we use, but it's not their product, it's a fusion cell product. All right, so the science, it's easy for COVID to spread, and it's easy because people will typically spread the disease before they have signs and symptoms. So if you think about that pre-symptomatic or asymptomatic being the people that will never develop signs and symptoms, these are the people that are out in the environment that are helping to increase the spread rate. And so as you start moving indoors for longer periods of time, specifically in the winter, you're going to see the potential for big spikes, which I think we're seeing right now. The South saw the same thing, but we saw it in the summertime when it was really hot outside and everybody was moving into the air conditioning to stay relatively comfortable. But then, additionally, we've been in this pandemic for over 300 days, and people are becoming complacent. The wearing of the mask, the distance, hand hygiene, keeping those bubbles intact when you talk about staying safe and staying isolated from other people, especially with the holiday season. People want to travel and see their families and see their friends. It's typically a gathering time. And in a lot of cases, that's not the most safe thing that people can be doing. And then On top of it, with an election year and that confusing political science versus actual science, there's sometimes messages that are partially right, but also partially wrong, as we'll talk about. So you will see guidance, guidelines, requirements, and recommendations come out from a lot of different organizations. Those can come from the local area, the state, from the CDC at the national level, the World Health Organization when you talk about international travel. Homeland Security might have a little piece in there. But really what it comes down to is, what is the best course of action and what is the science? And that science piece, that New England Journal of Medicine or whatever peer-reviewed publication, it's really, what do we hear and what is our evolution of knowledge telling us today? And why do we need this new intervention, this change in requirements? And so that's really what we help people navigate as we go through the COVID environment.
Yeah, and a point to this slide that we like to make is that everybody seems to have something to say about it, yet no one really owns the messaging and owns the mandates per se. So it makes it very confusing. And at the end of the day, the smartest path is to listen to what the science should tell you. And that's kind of what we've worked with a lot of our clients.
Absolutely. Thanks, Matt. That's a good add. So when we talk about the Fusion Cell experience and what we bring and how we help navigate into a safer environment, the safest reasonable environment for businesses, for airports, for schools to operate, there's 6 elements. We break it down into some easily digestible chunks that have different areas of focus. And so you'll see next to some of these who owns the benchmarks. And then that way you have at least a reference point of where to start if you haven't gotten there yet. So HVAC systems, increasing the amount of fresh air that you can bring in. There's an energy cost of that. Increasing the level of filtration within the filters that you have in the space. Bringing in HEPA filters, using alternative methods for disinfection, whether it's bipolar ionization, we're going to talk about that in a minute, UV lights, and a whole bunch of different stuff. But really, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, ASHRAE, has most of those benchmarks, and they've been relatively consistent since March-ish, when they saw the potential for aerosolization. So they put out guidance on the more conservative side then, but now it's right in line with what we're seeing. Sanitation is done through the EPA. They have an entire list, a spreadsheet. If you pulled it out, it'd probably be 45 pages of products that are all effective at killing COVID. And so that's their list of disinfectants effective against COVID-19. Health screenings. These can be things that you do to help exclude those that are sick from the environment. So attacking that pre-symptomatic and asymptomatic phase of people. Those can be hard copy, they can be electronic. ProtectWell is done, that's a product between Microsoft and United Health Group. It's free and it helps employers be able to electronically screen their employees before coming to work. And then you have your state, local, and CDC guidance on distance, masks, and hand hygiene. So if you do nothing, so if we had nothing in place, what would disease spread be like? So RT at the very top is the rate of transmission. So this is a conceptual model. The Massachusetts High Technology Council put this out, and it's basically saying one sick person can get 2 or 3 other people sick by not adhering to any of the guidance that's out there. Now, as you put on masks and you increase your distance to 3 or 6 feet, you drop that significantly, you cut it in about half. So one person will get 1 other person sick. If you start screening and excluding based on symptoms, as you add in increased air filtration and ventilation upgrades, as you clean more, as you control the flow and put spacing markers out and visually remind people, you can make it so that it takes 3 or 4 or 5 concurrently sick people in close proximity to each other to get 1 other person sick. So it's a huge reduction in disease spread just by putting in these non-testing interventions.
Yeah, and this slide, the first time Mike showed it to me, I'll be honest, as a non-epidemiologist, it was a little overwhelming to me. And just to really understand on that top swim lane, you go from 2.5 people that would infect if you do nothing, down to 1.6 with masks, 1.25 when you add in distance, down to 1 with a diagnosis. So it's basically the 6 things that Mike talked about can bring it all the way down to 0.5, meaning now it's going to take multiple 6 people to get 1 healthy person sick. And I think this is important and powerful science to see, because there is a lot of noise out there around the real risks in regards to how the disease spreads.
Thanks, Matt. All right, so engineering, how do you make the building safe? So the first piece that we talk about is always going to be the heating, ventilation, and air conditioning. As we pointed out earlier, ASHRAE is the folks that own the benchmarks on this one. They've been conservative from the beginning. In their controls, pump up your filtration to MERV 13 or greater if you can. Bring in more fresh air. Make sure you're exhausting air within your restrooms and those different zones so that you get good airflow. Control your humidity. 40 to 60% relative humidity is the target. Sometimes it's easy to take humidity out of the air in the summer months. It's not so easy to introduce it back into the air in the winter and cooler months. And then additional air cleaning technologies, and Honeywell is going to talk about this, and I think Doreen has a slide as well. But challenges, it's going to be based on system capability. You may not be able to get to MERV 13. So how do you get to safe operations? Like we talked about outdoor air temperature, as you bring in more fresh air, there's a huge energy cost that goes with it to maintain that ambient indoor air temperature. Relative humidity is going to be critical, and it definitely comes down to how much control you have. Do you have a system-wide building control, or is it space specific? And so this is some of the challenges.
Thanks, Mike. And I'm going to just talk about some of the technology solutions to meet those challenges. You know, Honeywell, we have for decades, actually for over a century, been in the HVAC control business. And as we kind of pivot some of our technologies to address airborne particulate matter, you know, we look at it as a 4-pronged approach. And as Mike's talked about, the issue is that the particles, when somebody sneezes, coughs, or even speaks, can become airborne. And so it's trying to eliminate that and minimize that exposure. So the first thing we want to try and do is eliminate it or before it becomes airborne. And we'll talk about that with some of the exclusion techniques that is part of the Big 6 piece. But controlling the air is one of the big things. And controlling the air includes ventilation pressurization techniques. For decades, we've done negative pressurization zones within hospitals. So you create a negative pressurized zone, like with a Phoenix control valve, that keeps the air from leaking in or leaking out from, say, ICU unit into adjoining spaces. So we can do that in critical areas or areas of high congestion, like restrooms, TSA checkpoints, et cetera. Mike already talked about humidity and temperature control. That's important. And then cleaning the air is an obvious one. So cleaning the air can be done through multiple different filtration techniques. Kind of the down and dirtiest technique is putting in portable room air purifiers. Honeywell manufactures a HEPA room air purifier. You see it in the middle of the screen there. It's this little unit about the size of a space heater. It goes in. It's 99.97% efficacy for a 456 square foot space. If you've got larger spaces than that, with high volumes, we can actually come out and do a study to look at the flow of a space and where people congregate and determine where the most effective place to put these units are. The other cool thing about this is you plug them in and you automatically, or immediately, can get indoor air quality metrics on this thing. So it's you can see what the quality of air is, and you can also even tie all of these in together and get a dashboard through a cloud-based solution. So that's kind of on the very low end, inexpensive, immediate, plug it into. Let's put systems within the existing HVAC systems in the air handling units. There's the UVC light solutions that are out there. The example on the far right is a electronic air cleaner sanitization unit with UVC on the back end for coil cleaning. This is something we've done for a long time in thousands and thousands of buildings across Asia Pacific. It's in airports like Changi Airport in Kuala Lumpur. We just got FDA approval over the last few months to sell it in the US and install it here. It's a retrofit solution where you have these EAC units that sort of rack and stack in a grid into existing air handling units. And it's a zap and trap type idea with 99.3, I think, % efficacy. And the idea is you've got a filtration system to get the larger particles, and then you ionize the remaining particles to attract them to filter plates, and then you zap them with UVC lights. So it's very effective. It doesn't decrease airflow through these units. Very cool technology. There's other technology I think Doreen's going to talk about with the bipolar ionization. We're doing that for several customers as well. Again, retrofit solutions. We don't rip and replace. We certainly try and respect existing infrastructure of our customers. And then just the last quick note I want to put out there is making sure that you're monitoring and understanding what the air quality is in the airport. So that may be having to install additional sensors. At Pittsburgh Airport, we have our existing enterprise building integrator control system in place. We've brought together the sensors that they had in terms of humidity, temperature control, and some CO2. We added additional sensors for particulate matter and total volatile organic compounds. And now we're pulling all of those data metrics up onto a dashboard so we can see what the overall quality of the air is in the different areas of the airport. So that can be used for the facility managers to help identify problems before they become, an impact on the health of the airport, as well as communication tool to passengers. So airports can say, hey, we're doing all this cool stuff up in the ceiling. You can't see it, but we're actually helping to protect your health. And we use this Healthy Airports dashboard to help communicate that out.
And that's actually real important. There are a lot of these strategies that you'll see that we talk through and that Mike talks through as well that have great impact, yet you cannot see them. So in those reports, the way that you market the things that you've done are as important in some cases as the strategy itself. At the end of the day, what we're trying to do is create an environment that passengers feel more safe to come and take advantage of.
Yeah, absolutely. And I'll just chime in as an additional side thought to that is that these are effective against COVID, but looking at the long term for cold and flu season, once COVID goes away, these are things that people are going to expect is better indoor air quality. And then also being ready for that next pandemic if it happens. So like we saw with 9/11, security increased on September 12th, and it has never gone back. And I think that we need to take a similar approach with indoor air quality and making sure that we are as protected as possible, that we've made these upgrades, but that they stick in place because as you see, a disease can wreak havoc and it can happen at any time and it can spread fast. We're a pretty global world here. And as you see in Britain, that just shut down all travel. Things mutate, things change, and being ready for that next strain or that next disease is critical. All right, so sanitation. Like we said, the CDC owns this, but states will put in their own guidance on frequency of high-touch items that need to be cleaned. And so that varies by state, but really it comes down to some easy control. So knowing what disinfectant you're using and making sure that it is appropriate for COVID, making sure that you know what your high-touch items are. So having a checklist, being able to claim responsibility for different areas. So knowing what the airport's responsible for cleaning, knowing what the airlines are responsible for cleaning, and knowing what tenants are responsible for cleaning. And making sure, like I said, the checklist is there so that you have a defined process that people can adhere to it and it's standard. And then validating compliance is just as important as compliance itself. So making sure that what you're doing is effective. The challenge is there's some cost, there's some ownership pieces with it. How do you validate? But I think the biggest challenge when you're talking about a standard process and making sure that the departing airport is the same as the arriving airport, it's that states have different requirements. So coming out with something that's standard that says we're going to clean every X number of hours, whether it's 1 hour, 2 hour, 3 hours, that may be more restrictive than what the state says. Just don't go less restrictive. Then there's variability in the cleaning supplies. There's variability in the cleaning equipment. So whether it's electrostatic sprayers, backpack sprayers, foggers, there's a lot of stuff that's out there. So just making sure that there's a standard process on how to.
Thanks, Mike. Nice lead in on what we do. We have been doing COVID cleaning for the FAA at Merrimack and Manchester, New Hampshire. We also do the COVID cleaning for the Otis Air Force Base in Bourne, Massachusetts, which covers 12 buildings. One of those buildings is a dormitory. We're adding this week the Beverly Airport for their tower. What we're requiring, every employee has to wear a mask. Also, the employees of where we're cleaning, they're required to wear a mask. We do the COVID questions on a daily basis. At Otis is actually per building, where their temperature is taken. They have to answer questions as far as their health, but also exposure. Do they know if they've been exposed to somebody else that has COVID, from whether it's their family or friends or just traveling? Do they know that? We also, for large areas, we do the electrostatic cleaning using the machines for that. We cover, for the FAA, we cover 3 shifts. So every time a new shift comes on for their air traffic controllers, they're coming into a clean area. We have specialty wipes to cover their electronics, their roller walls, their keyboards, so that those are clean before the new person comes in. We do the high touch areas, whether it's the elevators, the doors, the railings. And our employees are also taking care to make sure that they're not in danger. So they're either wearing the gloves, they're also wearing the hand sanitizer. All of our disinfectants that we use, although there's no such thing as a green disinfectant, because they're killing things. There's some greener ones than others, but we're making sure that they're all on the EPA, the CDC's list, the EPA's list, the FDA's list. We're coordinating to make sure that they're there. And we also keep backup supplies so that if we run into shortages like we did back in April, we have those. We're ready to go. And we use the higher level masks. We're not using the 1-ply fabric masks. We're doing heavier ones. I think that's it. I think we're on the ground.
Hey, thanks, Doreen. And I was just going to share some of the UVC solutions that can accompany the different cleaning strategies. So we have UVC technologies that span from aircrafts to the airport. I mentioned a little bit in the Induct solutions already, but we're working with many different manufacturers, including our own aerospace group, on these UVC solutions. If you see in the lower right-hand corner, we have a UVC cabin cleaning solution that essentially is like a beverage cart with arms. You push it up and down the airplane and it cleans the plane in less than 10 minutes. We've brought that forward into the airports. It's kind of a one-arm solution that can be used in hold rooms, can be used in restrooms, anywhere in the airport for the UVC cleaning. There's also essentially tunnel UVC cleaners that can be used for trolleys, can be used at security checkpoints for cleaning the trays. And we're doing this with some of our airports around the globe. And I think Ted Carniel, who's on from Honeywell as well, has probably talked to some of the airports that are joining us this morning or this afternoon, depending on your time zone now where you're at, with this technology. So this is very effective. Some of this stuff is portable. So it's something that you can put at the airport and try in different locations versus, installing the things above the ceiling. One other thing I want to quickly mention too is just the installation of UVC lights within rooms. This is technology we've done for a long time in hospitality with our integrated room management system, INCOM, that we're now bringing into other verticals, including airports. So you can put the UVC lights mounted into, say, restrooms, and then tie it to occupancy sensors to clean those spaces. And it really is about the amount of space you have, the amount of dwell time, and how many lights you need to put in. So that's something that we work with our customers to help define. So from portable solutions to retrofitted solutions, it kind of covers the gamut of the airports. From the airplanes, we've worked with companies like JetBlue with the UVC cabin cleaning, Thai Airways, Southwest, to help sanitize the airplanes. So lots of different technologies out there. Back to you, Mike.
Yeah.
Awesome, thanks. Yeah, UVC light has been used for decades in hospitals. It's been used in ducts. It's been used in the upper room for open spaces. So it's definitely a technology that's been around for a while and has been proven effective. Another thing to consider on the sanitation piece, as Matt may have talked about, the International Sanitary Supply Association, ISSA, has partnered with AAAE and a couple airlines out there to bring this Global Biorisk Advisory Council, the GBAC STAR certification, into play at some of the airports. It's really about prevention. It's geared towards the facility managers, those that oversee the cleaning and sanitation, to validate if it's contracted out or internal employees doing it, to validate that they're doing the right thing. The rates are based on terminal space, but there are 20 different elements of the sanitation process. There's a readiness assessment checklist that goes with it. And it has, the focus was going to be on pandemic responses. It just so happened that they rolled this out a few months early because a pandemic actually happened. So the focus is on proper cleaning, proper sanitation, and making sure that everybody's trained to do the right thing within the spaces. So we talked with ISSA. We ran through some of their GBAC stuff for Manchester, and we validated what they were doing is pretty darn effective, and it's a relatively low cost buy-in. But as Matt said, this is something that helps that marketing piece to say, yes, you're going to see more cleaning happening, but here's also why it's effective. And here's our outside certification. They do have a certification badge that comes with it. So if you haven't considered it, definitely something to look into.
Yeah, Manchester actually just got the green light, I think on Friday, that they have been approved and they have gained the badge and the seal. You're talking thousands of dollars as an investment, not tens of thousands. So I think it's relatively affordable. Like Mike said, it varies depending upon the size of your terminal. But it's a program that was well in play prior to COVID hitting. I just think the timing of it turned out to be good for them. And it is something that's actually, you can physically put your hands on and put on your websites, put throughout your airport, the actual seal and badge that you've taken this extra precaution, and here's what you get with it.
Awesome. All right. So Deborah mentioned earlier, keeping sick people out of the environment. So making sure that you have the healthiest folks possible that are coming through the terminal space. So what does that mean? So here's some of those misconceptions, right? Fox News and CNN and a few other news outlets came out on, I think it was December 1st, and they said quarantine is now 10 days. And that's not exactly true. What the CDC has said is that states and local health departments can determine if they want to use a 10-day quarantine as an alternative to the 14 days. 14 days is still recommended, but there is economic impact to those folks that are doing 14 days. So you can accept back some risk And that risk is a 10-day quarantine, somewhere between a 1 and 10% chance that somebody will complete 10 days of quarantine and still become infected. So it's relatively low. At the 7-day plus a negative COVID PCR test, it's about 5%, because it's a little quicker time, but it's right in that range where you would want to test somebody for that pre-symptomatic or asymptomatic piece of it. And so it's about 5% residual risk with 7 days plus a test. So states and local public health departments can make that determination. In New Hampshire, it's definitely a consideration. As soon as it came out, the next day, this was in their guidance. But really, the CDC is still recommending 14 days. Now, I think more important, though, is that high risk or the higher risk, which is still safe. So the CDC has said if you have a critical infrastructure worker, for right now, that might be a snow removal person, and they are on quarantine, so not isolation, they're not sick, they were just exposed. They can come in and they can do their work if they are wearing masks 100% of the time, they're sticking to strict hand hygiene, there's a daily screening that includes temperature checks, they're asymptomatic, they're by themselves, and then they clean everything they touch. So it's really about keeping them in their own private little bubble and cleaning the things that they touch. And so that is a way to use them, even if they are otherwise quarantined, because they are critical to the operations. If they're not there, they might, everything might get shut down. So if you have people that are critical, I would highly recommend that you start defining those job functions. So snow removal, maybe IT, maybe something else, things that will shut down if somebody's not in person, and define who would fit that criteria before it happens so that you're not on the back end trying to scramble. But really, the takeaway is that there's multiple options for quarantine, and there is an option to use people that are on quarantine if it's a huge impact to the company. What didn't change? Isolation. So if you are sick, you are still required to stay at home for 10 days after symptom onset or positive test if you didn't have symptoms. So 10 days, you have to have symptom improvement and you have to be 24 hours with no fever, and that's without taking Tylenol or Motrin. So this has not changed. So how do you keep it safe?
So, Mike, a couple of strategies is to help keep people out of the airport. And I know many of the airports have started with the rapid testing on site, et cetera. The technologies that we're bringing to bear are around temperature screening and then mass detection, as Mike shared early on with that kind of swim lane of masks are the first strategy of defense. So we actually are a large manufacturer of PPE equipment, and we stood up a plant to manufacture N95 masks up in Rhode Island recently this year. And then we have technology to make sure people are wearing them appropriately. So it's not just, do you have a mask on, but do you have a mask on that covers your nose and mouth? So there's with video analytics and the cameras, you can do essentially a type of facial recognition with the mask detection and do compliance. And what we're seeing with airports and some of our other customers is that it's really not necessarily that you're going to deny access, but it's a trending piece to see how are we doing for compliance in certain areas, maybe at the entrance to an airport versus in hold rooms outside of restaurants, et cetera. So we have this technology in place at some universities, at some commercial office buildings, and right now we're doing a pilot with San Diego International Airport in their innovation lab to help identify the right use cases with the mass detection. The other piece is keeping people with temperatures out of the airport, or identifying them and putting them for additional health screening. Maybe they go into health screening room for additional questionnaires, et cetera. And the temperature screening, there's lots of technologies out there. We manufacture a core body temperature screening camera called Thermal Rebellion. We have that in place at JFK's Terminal 1. And the cool thing about that is it lowers the false positives that you get with some of the other temperature screening components. And it's a very rapid way to identify temperatures and you can tie it to access control as well. So if you have a badged access control, say for staff or crew, you can couple this with, does a person have a temperature? Or are they complying, wearing the appropriate PPE, in this case mask, and then either allow or deny them access to certain areas within the airport. Mike, you're on mute.
All right, so we talked about engineering controls. So making that building safe before people get in. We've talked about exclusion controls, so keeping the healthiest people within that space and keeping as many sick people out as possible. So now it's into the administrative controls, those things that revolve around individuals' behavior. So masks are one of those items that has a lot of variability with it. So the World Health Organization, let me start with, masks are very good at stopping an individual who is sick from coughing that sickness out. It's not as protective as an individual who is well being protected from breathing that air. So it's about source spread control, not about individual protection. And this goes back to the idea that pre-symptomatic and asymptomatic people, those without signs and symptoms, can spread the disease. So it's really about putting masks on as many people as possible to limit the amount of droplets or aerosols that are coming out of their respiratory tract. So the World Health Organization has concluded that cloth masks are good for source control. They offer some personal protection. They pulled from a lot of different journals to do this study, this reviewed study. And what they found is that 2-ply cotton is acceptable. What is even better is a 3-ply combination mask where the layer touching your face is cotton. The outermost layer is a woven synthetic fabric, and then that inner or that middle layer is either or. And at that, you have a significant reduction in what's going out, but also some protection on what's coming in. Alternatively, the University of North Carolina came out on December 10th with their JAMA article around the protective qualities of different types of masks. So that protection factor. So not the source spread, but what it does for the wearer. What they found is that a nylon 2-layer mask with a fitting nose piece is protective for the individual. They found an efficacy rate around 74%. N95 right around 98%. Surgical masks about the same. So the key piece is that it's tight fitting and that it forms to the nose and there's not a lot of air gap in there. The only problem that I have with their study is that it included exactly one participant without any facial hair and surrogates for COVID-19. So whereas the World Health Organization has looked at all of the studies that have been produced, this one was exactly one person in a lab under ideal conditions. So take it with a grain of salt, but you know, as I talked about, the body of knowledge is evolving daily. Things that didn't seem reasonable before are becoming more reasonable today. So the official stance of the World Health Organization as of 1 December is that masks alone do not cut it. You have to have masks as part of that comprehensive package to include distancing, hand hygiene, de-densified spaces, and increased indoor air filtration rates. All right, so distance. This is CDC, World Health Organizations have weighed in on this. The ideal distance is 6 feet. A lot of people have trouble figuring out what 6 feet feels like because if you ask the average person, or at least did back in March, April, May, when you ask for 6 feet, they would typically give you a distance that was around 4.5 feet. So people usually underestimate what that distance actually is. And so keep that in mind. Minimum 3 feet is still protective. That's what the World Health Organization is using as their standard right now is 1 meter. But 6 feet is ideal. So how do you do it? How do you police COVID? Who owns that piece? How do you challenge autonomy? And then how does the technology work with families that are traveling together that can be closer? And how do you keep those families away from the individuals that are outside of their family unit?
So one of the ways to do that, and I think what we see is, and as I'm traveling a little bit between California and Minnesota, I see, the cheap and cheerful strategy, which is stickers on the floor, signs in the chairs, et cetera, to encourage social distancing. We can layer on top of that video analytics to understand if people are within 6 feet or less. And so the little graphic you see here is green versus red boxes around those that are maintaining the appropriate social distancing or not. This is certainly adjustable metrics. And what we're seeing here in the use of this technology is not so much that people are going to go out and police it, but it helps identify congestion zones. And then it can be tied also into public address systems. So if you're seeing a lot of non-compliance to the 6 foot recommendation, doing reminders on the PA system to tell folks to social distance. You may also see, mass detection, non-compliance. So you can do that over the PA system. But it's really more about trending and understanding where there are congestion points and acting on that. And what we've heard from airports is that they are more having people, airport staff kind of go around and help reinforce the crowd compliance on social distancing and mass detection at this point. So taking, just watching what's happening within the airport and going around and reminding folks for social distance compliance. So these video analytics can supplement that and help direct where the staff should go. And this is also a technology that we're working with San Diego to help fine tune those use cases and understand where the best value comes in the different areas of the airport. Okay. I wanted to just share a little bit too around the sensitive areas like in restrooms, and Mike had teed up hand hygiene as one of the big 6. Hand hygiene is, I see again, cheap and cheerful stickers in the airports, singing the happy birthday song, that sort of thing. But there are hand washing analytics. So there is technology here to help understand if there's being the compliance for hand washing is happening. And this is technology that we have had for a long, long time in the healthcare industry, kind of the tag in, tag out, or entry and exits, where you can have sensors on the hand washing or the sanitizers to see if they're being activated and tied to badge access. It can also be tied to sensors like for occupancy or people counting. So you know how many times the faucets are activated within a restroom based on the number of people that are in and out of the restroom. This is not meant to say necessarily police, but it's meant to provide trending and data analytics to help reinforce and remind folks of the proper techniques. So, thanks.
Thank you, Deborah. As you're speaking about the hand sanitizing and washing their hands, what we're bringing on and what we're adding in 2021 is we now have technology to let your employees know, or whoever you have, when those hand sanitizing stations are running low. So you're not running around trying to fill every one. It's more targeted and better use of the employee's time who's responsible for those hand sanitizers. They also, those hand sanitizer stations, you can designate the amount that's released. So you're able to use less hand sanitizer versus when you go up and you put on the hand sanitizer and you're looking for a paper towel because too much has come out. You can designate the exact amount. So that's more of a savings for employee time and also product time. What's new for US Eco Products this year, and it's not new technology that Mike has talked about and Deborah's talked about, is we're bringing on bipolar or needlepoint bipolar ionization. This goes in your HVAC systems, and what it does is sends out both positive and negative ions that are attached to the pathogens, whether it's the COVID, E. coli, Legionnaires, staph infection, which makes them heavier and that they drop, and it's easier to pick up. And it also, it eliminates the hydrogen that those diseases need in order to survive. And those go into, it's a simple piece that goes into your HVAC system to eliminate those. So we're not only looking at COVID as we are today, it's been used in the past for the Legionnaire, the staph, norovirus, and anything else that comes along in the future. This is only new to US Eco products in 2021. Right now, it also can eliminate odors. It's being used right now at LaGuardia, Dallas, Fort Worth. It's in the Mayo Clinic, Boston Children's Hospital. And those are just a few places that I'm aware of and I'm letting you know about. And this is something new for US Eco products. We're trying to be proactive there. So not to use as much disinfectants or as many chemicals, although you're going to still have to, but let's do it in a more effective way to handle these.
Yeah, and just to go back to the needlepoint bipolar ionization, that ion transfer helps kill COVID and other viruses. It also helps things settle, but it does increase the amount of times that you have to do sanitation, because as those items are settling out of the air, they got to go somewhere, and it's typically a flat surface, so that dusting can become more frequent. But it's not limited to just ducted systems. So some of those technologies out there can be put into split unit HVAC systems or heat pumps, things that are typically non-ducted but control the comfort within different spaces. And then they are also exploring technology to put those into the heating systems within buses and transport, and use that as another mitigation strategy for as you're seeing those hotels shuttle people back and forth. This is a way to help clean those airspaces.
Just to give a little context here, Mike, as we roll into the case study for Manchester, Boston. I know Carl was going to speak a little bit to this, but I'll kind of step in just to give context. So Fusion Cell partnered up with both Ted, the airport director, and Carl I want to say around June of, towards the end of June, heading into the 4th of July weekend. And in essence, what they were looking for was a little bit of a gap analysis to say, okay, we've always had protocols for a virus outbreak. A lot of them were in very good people's heads. Some of them were, in fact, detailed out. But certainly, like I think a lot of airports, there's probably some dust on them. And they were forced very quickly into, okay, where do we stand right now? And what's our path moving forward? Over the course of the next probably 2.5 months, and Mike's going to speak in detail, we partnered pretty closely and walked through an analysis that produced for them both commentary on what they did have in place, addressed some gaps that existed, and worked closely with them as they pulled some of those and closed some of those gaps and bringing in some new policies, practices, technologies, so on and so forth. So Mike's going to talk a little bit through the process that we went through with them. And I think it gives a good indication of where a lot of airports were when they started, and maybe some insights into where a great place would be as they move towards, kind of the tail end of it.
Thanks, Matt.
One last thing as well that I know Carl was going to mention. Another big part of this in their decision making, a lot of things they've done came in parallel with their CARES Act money that became available to them. And these are all strategies. That's what they used it for and continue to use it for. And it was a big part of them being able to do a lot of the things that that you're going to see through these different pages.
Awesome. Yeah, so we started in the summertime. And what we looked at is we had a bunch of sub meetings with the spectrum of folks that come in and work for and around Manchester Boston Regional Airport. And so what we did is during those sub meetings, we validated the planning tools that they had in place. And as we were talking about things that they should be considering, the moment we were done with those sub meetings, Carl and his team, whether it was facilities or with their cleaning contractor or whoever, ran out and started implementing. So it wasn't just a validation, it was as soon as they had better information or a way forward, they jumped on it, which is nice. But one thing that we saw that was lacking was a pandemic response um, planning tool or execution tool. They were operating under COOP. They had a suspect disease policy, but that kind of limited in its application, and it wouldn't have been appropriate to just throw COVID stuff on it because it's more about what do you do for a single case, whereas this is the potential to be everybody. So we created an annex for pandemic operations, not specific to COVID, but pandemic influenza type annex to go with it, so that they can stepwise walk through the process of what they would be doing and have defined points where they can have those interventions. We validated what they have already done. We have extensively walked through a day in the life of staff, of guests, of visitors, and then validated what they had in their logistics and supply chain. And they went out and they beefed up their storage and capacity to hold some of the cleaning products, which has been a godsend because a lot of folks have seen supply chain issues come up, and it hasn't affected MHT as much as some other businesses that we've been working with. All right, so HVAC upgrades. This was already in place, so this was a validation piece. They already had MERV 13, but we talked to them about UV light disinfection. We talked about in the HVAC system within the vehicles that they have, and the iWave as the brand name for the bipolar ionization, needlepoint bipolar ionization for purification within their HVAC system. So these are things that they investigated, seeing where it synergizes, best place to put them. And so they were looking at this. Next is sanitation. As Matt jumped in, they went out and they jumped on the GBAC Star certification, and they completed all 20 elements, and they are now GBAC Star certified. And I'm sure you're going to see those little badges pop up everywhere around Manchester Boston Regional Airport. But I think the biggest strength was that, and this was from their contractor, JCM, and also from the folks that were on the meeting, there was a great relationship. JCM specifically said that they've never, Manchester's leadership team has never missed an opportunity to thank them and say they're doing a good job, which is great. And so as you look at what they implemented, JCM had different color outfits for the folks that are doing sanitizing, so that they're highly visible, so that people in the terminal can see the cleaning folks going through. And that supported all the different changes that they had for disinfectants, because you would just assume that what they had was effective, but now you see people doing it, you see the certification that they have the extra training. In New Hampshire, the state guidance is every 2 hours for high touch surfaces. Manchester had their folks, JCM, jump in and do hourly. So they're twice as often as required by the state. So those were some highlights. Then we jump into additional stuff. So no touch hardware. As you think about going into those restrooms, less things that you have to touch, either coming in or going out, is a good thing for hand hygiene. Exhaust fans that are constantly serviced within the restroom, so that making sure that service piece is there to validate that what's in the restroom is being exhausted completely to the outdoor space. Alcohol hand sanitizing stations, what they did is, since they were only using half the terminal, they recaptured the alcohol hand sanitizing stations from the other half and brought them into the used portion. And this is one thing that I don't think a lot of folks have thought about, but a medical isolation room. So if Mike Klingshirn is in the airport and I get sick, where do I go if I'm waiting on my ride to come get me, whether I'm arriving or departing? So how do you isolate me from everybody else? And what they did is they recaptured one of the unused baggage claim offices. And they just turned that into a medical isolation room where they have some PPE, the surgical masks, they have hand sanitizing stations, and they threw in a portable HEPA filter to help change out the air. And signage saying, don't come in here unless you're directed. And that way, if I'm waiting for a ride, I have a place to go where I'm separate from the rest of the population, but I'm separate and safe. And the second piece of that is if you do have somebody, the last thing you want to do is kick them out and say, take a bus, take an Uber. You don't want to put them on public transportation. So making sure that they had a ride of some sort, a family member or somebody that can come get them, if at all possible.
And a lot of things to that point too, Mike, comes into looking at the floor plans and the layout of the airport, where that room actually exists.
Absolutely.
Right? So how do you get people there? And then from there, how do they get out with the least amount of traffic as possible?
Yeah. And if you don't have the space, you can always put somebody into the outdoor areas. Remember that outdoor air doesn't require that mechanical filtration. It's really just fresh air that's going to be blowing through, but you got to have considerations on what the distance is between other folks and where they're going to stand and who's going to pick them up. All right, so exclusions. So if you're sick, stay home. That's about as easy as it can get. But what they had is a robust alternative working policy for municipal staff, that ongoing education around signs and symptoms and when to stay home, and then screening of for the partner, whether it's an airline or the restaurants or whoever's working at Newport News that day. Just making sure that everybody that's coming in as a worker is screened. And then there's also a screening piece for the airlines for all incoming passengers. So, you know, that attestation that no, I'm not under isolation or quarantine and I don't have any of these signs and symptoms. There is a mask mandate. So when you get into that behavioral piece, those administrative controls, this one took a while to get to. There was really that live free or die mentality. And the governor did, or actually it was the mayor, the municipal mayor came out and said, everybody wear one. So when you are at Manchester, Boston, there is a mask mandate. You have to have it on. So this goes back to that compliance, that making sure it's not just on, but it's on and it covers the nose and the bottom of the face. You're going to see signs on the floors, all the terminal spaces that reemphasize that distancing, making sure that there's a ton of hand sanitizers. Once again, visual distancing, making sure you have considerations for the non-ticketed guests. So come home from my deployment, my wife and child are sitting there, making sure that they're not just roaming around, but maybe there's an area where non-ticketed guests stand and they're socially distanced apart. Family areas, different cleaning procedures to think about for nursing rooms, the restaurant areas, and then how do you distance people within an elevator, whether it's every 4 corners or you limit it to 1 person or 2 people, or depending on the size of the elevator. So these were all considerations that we had. How do you stagger the arrival so you don't have a bottleneck of employees checking in all at the same time? That would typically bust that 6-foot close contact distance. And then making sure everybody can leave and leave effectively through the most efficient route. All right, so different strategies, you know, mitigation for food service, making sure that everybody's adhering to what the CDC, the American Industrial Hygienists Association, the restaurant associations, and what the state and local areas are saying around food service. Nursing rooms, typically, if you have those pod systems, they may not be connected to the HVAC system. So increase cleaning, maybe throw a HEPA filter in there so that the air is as clean as possible. What do you do with children and making sure that everybody knows that those kids should be with an adult all the time? And then how do you use vehicles, whether they're landside or airside, and making sure that they're sanitized appropriately? Well, there's definitely some HR considerations. So you have the Family First Coronavirus Relief Act. There's some amendments to FMLA from Department of Labor. So making sure that you have all those COVID pieces that are integrated into your response effort. And then on the workers' comp side, so if somebody does come down with COVID and they claim they got it from the job site, how can you do that due diligence report to say, no, it's less likely that they have gotten this from us. Look at all the interventions that we have in place. And here's the day that they say that they were around. So being able to say yes or no in those cases. And then validation, yep, we talked to everybody. Some were very fast to get back to us. Some took a little bit longer because they got a bunch of bosses. I understand that being on the military side for 10 years. But in the end, we came up with a process and some procedures that were standard across all the folks that work there. And this was one of the key elements that we love, is that all the partners seem to have very close response plans in how they deal with COVID. All right, so as we wrap it up, like I said before, 9/11 happened, and on 9/12 we had all of those new security procedures that were being developed. And then now we see this pandemic. This is something that has the potential to come back, whether it's COVID or the next disease. And so making sure that you're prepared for the next thing. There's never going to be a zero risk for COVID as long as there's community transmission. But what you can do is reduce the likelihood that COVID will be transmitted person to person within your space. Vaccines are coming online, but there are limited numbers right now, so availability. We're still determining efficacy because typically vaccines are tested on the youngest and healthiest people to make sure that they don't die. And then from there, they roll it out to larger populations. So we're still determining efficacy, and then compliance. Not just is it available, but are people going to take it? And so as you look at those state draft plans for how they're going to roll out their initial stuff, typically healthcare workers, older populations, nursing homes, VA nursing homes, those are going to be your highest risk folks that are going to have access to the vaccine first. And then you'll get into some of those second tier or third tier people. And so until efficacy and compliance is probably around 60 or 70%, vaccines are probably not going to be a major play in how safe a terminal is. But what I want to recommend or reiterate is, as we saw in that first slide, that swim lane, as it was called, exposure does not need to equal disease. If you implement these non-testing, non-vaccine related behavioral stuff, you can reduce the rate of transmission significantly within a space. And that goes back to the fact that asymptomatic and pre-symptomatic people are going to be present. In an airport, it may be a little bit more because people may just want to travel even though they know they shouldn't. They paid for the ticket, they want to hop on, they don't want to get that rebooked date. So it's time to go, let's do it. I'll throw on my mask, nobody will know. So there's going to be complacency, there's going to be fatigue. There might be folks that travel when they know they shouldn't. So this is reasons why these interventions are in place, and reasons why we help Manchester get there.
I think that's the last slide, Mike.
Sure looks.
Yeah, and there's a couple other points I know that I know we're talking about, Ted and Carl, through the presentation that we did with them, very similar to this one. One is just recognizing the fact that these strategies aren't COVID specific, right? These are strategies that the military's been using for decades for all types of disease, right? For all types of viruses, for all types of pandemics. And there's been many pandemics the military have been involved in: SARS, H1N1, Ebola, just not here specifically. But one thing I think that Ted said that really stuck with me in our first meeting was that each regional airport is one passenger, one flight away from a passenger potentially coming from anywhere in the world. So even if you're not an international airport, certainly you have to operate kind of under those same things. But the other point here is that the strategies, for instance, that Manchester has gone through here, these will endure far past the COVID period. And hopefully, we hope more than anyone that is coming sooner than later. But these are all strategies that will make for a better airport period, like Mike said, very similar to 9/11. And there's a unique opportunity in some cases where, with the CARES Act and other vehicles that have been made available, there's a way to kind of pay for some of this infrastructure, the stuff that Doreen and Deborah have talked about, that will endure far past kind of the COVID phase of what's going on here. So those are some really important things. Another thing is, if travelers knew what you just saw today, I think they would all feel a lot more comfortable about travel. So the question becomes, how do you do that? And obviously, Deborah, Doreen, Mike, myself, we can help airports get there if it's something that they think makes sense for them. So I don't know if Belinda wants to add anything to that, but other than from there, I think we could go into, or Deborah or Doreen would go into any of the Q&A that might have popped up.
Yeah, that's great, guys. What a great session. I'm looking in the chat and I don't have any specific chat questions, but if anybody does, please feel free to type them now or text them now. I know I've gotten some previous questions when we had announced this summit. I don't mind going back to them. One of the questions I had received was the hypocrisy that the appearance of hypocrisy for our passengers and keeping them 6 feet apart. We've got the tape on the floor. We've reduced our sterile hold rooms. We've removed chairs and seating. We don't allow them to eat in restaurants, right? And then all of a sudden you're sitting with them in the row 23 of the aircraft and you're now like this close. So how do you get over that seeming hypocrisy for your passengers?
Yeah, that's a great question. And so I think the best thing to do is maybe on your websites, link the most recent Harvard School of Public Health publication about their gate-to-gate COVID risk. And so once you board an airplane to once you get off the airplane, what's your risk? And they came out with the fact that it is safer to fly on an airplane, even if you're shoulder to shoulder, because of the way that the air moves within that airframe. So typically, a circular pattern instead of front to back. So you got that circular pattern and then top to down. So if you do cough, all those particles are going straight to the ground and not to the folks in front of you. And so that, coupled with the HEPA filters that are on all aircraft, make it way more safe than, like Harvard said, more safe than going to the grocery store or a movie. And
Great.
so the critical piece that I see in there is not so much what happens in the terminal space as you're waiting, or what happens in the aircraft as you get in and you're sitting down for these long flights. It's probably more about the boarding process and making sure that that distance is maintained within that air bridge, and then once you get onto the plane.
That's very good. I'm going to be looking for that link for sure. It's a great idea.
Yep, and I'll find that and I'll send it to you, Melinda. And also, second to that is Harvard is doing a curb to curb assessment. And so that's going to come out in the spring of 2021. And they're going to look at walking through a terminal, getting to that gate, flying on the aircraft, and then getting to the other curb on the other side. They're going to do an assessment around what does that look like? And is it significantly different risk than those other things that they've talked about?
Okay. Question previously sent to me. So as an epidemiologist, when you're flying, what do you do as a passenger?
Oh man, what do I do? It's one of those things where if you ask the food inspector, which we also do on military bases, what places they don't eat at, you're going to get all the good restaurants. And so we typically know what the risks are, so we will go out to those shadier restaurants and eat there. With COVID, I don't travel much on airplanes, but if I do, it's going to be, keeping my distance from everybody, wearing a mask, and just making sure that my kid washes her hand, because she touches everything and her hands are usually gross.
And Mike can also make available his travel playlist for people as well, if they'd like to see.
Yeah, absolutely. Some calm and soothing music.
Exactly what's on the travel playlist.
Oh man, a lot of J-Lo and Enya.
Oh, very good. Well, if that provides you with some comfort of traveling, very good. We're doing still pretty well with time, What do you see as the future of gatherings of the public? Will we ever have concerts again? Will we ever have a food court that's at capacity again?
Yeah, I think we're going to get there. I don't think that we're going to get there soon, probably not by summertime. But it's going to revolve around a few different pieces of the puzzle. So if you think about a disease, it's really looking for people that can still be infected. So if you have people in that 3-month window post-infection, they're not really in that susceptible population. If you look at people that have been vaccinated, once again, not in that susceptible population. And so as you get into that herd immunity, whether it's from an infection or from a vaccination, that's when you start to see disease transmission rates drop. And so I still think that we're going to see masks, you're going to see distance, you're going to see hand hygiene sticking around in the long term. If I had to guess at which one is going to be dropped first, it will probably be definitely not hand hygiene. I think once you get out of that susceptible population and into herd immunity, it'll probably be masks, but you'll keep your distance, if I had to guess. And then you see what happens, and then after that, it'll be the distance piece. But I think that maybe, I'm not even going to put a number on it. I don't know when this is going to go away. I can tell you that seeing how fast it's spreading right now, it took us 3 months to get to 1 million cases. And it took us about a month to jump from 10 million to 17 million. So with the number of cases in the US, you see that exponential growth that we're in right now. So it's going to be a while. And it's going to require people doing the right thing, and vaccinations, and then that immunity that comes from previous infections.
Okay, very good. Is it possible to no longer screen share the presentation, and
Yeah.
we could see maximum participation in case anybody just literally wants to raise a hand to talk if they don't know how the chat feature works? Otherwise, we will look for last statements from our speakers. I know that Paul McDonough had mentioned that there's a Sunday Boston Globe article that has an interesting take on airflow analysis. If anybody wants to Google that or talk to Paul. Okay, last thoughts from our speakers, please.
Deborah?
Hello,
Yeah,
uh,
Doreen? Yep.
I just want to thank everybody for being on this call today. We are available, and for new technologies, whether working with Honeywell or any of the others with the bipolar ionization, we are available for that. And I just hope that people wear their masks and do the hand sanitizing. Mike, as you move to Florida, I have friends down in Florida, and it's county by county. I have a niece in Sarasota. Her children are going to school remotely. I have another friend that's in a different county, and they're having their church services side to side with no masks, and her children go to school without masks. So it's sort of the Wild West out there. And I hope we can all gather and come up with solutions so that we can travel, because I can't wait to travel again. Thank you.
Hey, I'd just like to thank everyone for your attendance today, and thank Fusion Cell and AAAE for letting us participate, along with Doreen from Eco Products. I am passionate about restoring passengers' confidence in air travel. I am one of those passengers that is traveling, and I'd rather get on an airplane than go to the grocery store, as Mike said. So because I know all the great stuff that the airports and the airlines are doing to keep us safe. So appreciate the opportunity to share some of the good things that are happening out there. And thank you.
Yeah, it's been awesome to collaborate on this project with Deborah and Doreen. I know that they both bring great solutions to the challenges that are out there. So hopefully this presentation help bring it down to that low level of, okay, here's an intervention we can do. Here's the CARES Act money that we can spend, and here's the people that are in charge of those solutions. I hope you all found this to be helpful. Reach out if you need us.
Yeah, just last piece from Fusion Cell. So we will send this presentation, make it available for everybody. I'll work with Melinda on that. In the last point is there's really two pieces to this, and it was two important pieces of Manchester. Was one, figuring out what strategies will give them the safest environment and the best profile. But the second, as important piece is how do we then market what we did so that passengers can actually appreciate it and their confidence level about being okay to come here happens. And I think the more regional airports that we can get on that same sort of standard, because a passenger may feel real comfortable going to Manchester, but then they get and they fly somewhere else and they want to feel as comfortable about getting out on the other side. So, like Mike said, we got some experience under our belt here with Mike and the rest of a team of 15 behind him. And, we'd be willing to work with anyone who might see it makes sense for them.
Great. Such a good message. What great information to bring to our members. We appreciate your time today. We appreciate our members' time today. Thank you to Honeywell. Thank you, US Ecosystems. Thank you to Fusion Cell. To everyone, have a safe and happy holiday. And we look forward to seeing you in 2021.
Happy holidays. Thanks.
Happy holidays.
Happy
Thanks, everyone.
holidays.
Happy holidays.
See you,
Thank
everybody.
you.